We are recording. Okay. Hi, everyone. For those of you that don't know me, I am Jen Whitaker and the Assistant Director of our IBHS program in the Delaware Valley office. And with me is Kathleen Sammer, our ABA Director for the IBHS program. What we have now done here is created a test client and enrolled this 6-year-old individual into IBHS. And a few weeks ago, Kathleen and myself made a example treatment plan within IBHS. So today we are going to go through that and add a second goal to then submit, and a video will then be provided to utilize as training. So this is our IBHS treatment plan. The components of it are very similar to the BHRS treatment plan, but there are definitely some differences. And Kathleen is going to be able to kind of guide us through some of those clinical changes that we'll be really focusing on. So the completed information tab is very similar to what you're used to. We have the treatment plan date, which is going to be the day that you started working on your treatment plan. Then we ask you to have your authorization dates. This is going to be calculated based off of the dates on the plan of care, the dates of the authorization. What we would then have you do is put your name here and then submit the treatment plan to your appropriate supervisor. There are some changes to the demographic page, all of which I find to be really positive changes. Specifically, if you scroll to the top, the address and some of this information will be populated. However, you can add the family background information. And what is neat and different about the new plan is that you can enter any diagnostic changes, any medication changes, and the strengths section and the needs section. So I'm gonna go back up here and starting with the diagnosis. So whatever is inputted into this chart is populated up here into this section. Kathleen and myself went through and gave Elmer a diagnosis of autism as well as ADHD, which you can see right here. We also prescribed him clonidine at bedtime as needed.
Jen, just to clarify too, when somebody has a medication change, are they able to change that with the next update? Are they able to add their own medications in?
Yes. So at every review,
that's a change for us too.
This can all be changed. So this is our very first treatment plan when we go and submit it, and then at that time that you would be reviewing your plan, this is not locked. This can be reviewed and changed within each authorization or treatment plan review.
Any revision? Okay.
Section is similar to where you would just put in your resources, community supports, and any additional community or service to increase family resiliency. Here we put that the family could benefit from support of a blended case manager. Additionally, the client could benefit from social lunch bunches at school. Parent may contact NAMI to increase parent support for parents of children on the spectrum. What is great about this next section is that you can alter the strengths and the needs now. This isn't something that needs to be previously done in the demographic page, but it can be fixed up right in this section. And it allows you to choose a category, the strength, and then write in the narrative here, which populates to this section.
Oh, right.
So we gave Elmer a behavioral strength and said, When tasked with novel demands, Elmer works through his own frustration and will diligently try to accomplish new tasks, even though they can be challenging to him. Similarly to the strengths, this is our needs section. Right here is the grid that then populates into this table. So for Elmer, we gave him a behavioral need based on communication, and we wrote, Elmer has a difficult time communicating his wants and needs with enough detail to convey what his problem happens to be. Instead, Elmer may yell self-depreciating words such as, I am no good, or I hate you. This last section of the demographics page is identical to our current BHRS treatment plan. So there are some barriers to treatment and the clinical update.
And can I chime in on that?
Absolutely.
So for barriers to treatment, just be sure that you're writing in a way that is respectful of what's happening with the family. Every now and then we'll see treatment plans and the barrier section, which is legitimately a family challenge, can be written in a way that sounds less than kind to the family. So there's always ways to be creative and say the same thing. So if you're having a difficult time with the barrier section in explaining something that is impacting the case and you're not sure how to phrase it in a way that makes sense, please reach out. Like I'm happy to help with that too. Just so that we're making sure that we're kind of meeting the family where they're at. That's just something that's popped up a few times. That should say neurotypical peers. We have a typo, John, sorry. We have neurotical peers, which would not be personally helpful. There is like that.
There we go. That's wrong.
Thank you. It doesn't ever spell correctly. It always catches it too.
Is there anything before we move on to the first goal that you would want to add to make sure that this section is as strong as possible, Kathleen?
The only other thing I would think about is if you go down to the clinical update section.
Yes.
Clinical update is really that kind of case, where the case is landing right now, which I realize is harder in the beginning, but as you move through a case and you add additional off time, something you can think about doing, and this is personal choice, but I prefer to do this, is maybe once you go to revise this the first time, put the date that you originally wrote this paragraph above it, and then start a trend where below that you're writing, August of 2020, and you're giving that clinical update, because it does give providers a really clear kind of understanding of where you're going with treatment as a whole with this child. And it also helps if you need to come off the case, if the child transitions to another clinician, whatever the case may be, it does give a really nice snapshot of, hey, 2 authorizations ago, this child was not able to speak and was tantruming for 20 minutes at a time, 5 times a day. Wow, now this child has, a whole 2 to 3 word phrase kind of style of communication and is now only tantruming once or twice a day for 4 minutes. So it does give us kind of a really quick snapshot on where a child has landed in treatment over the authorization. So it's just a nice idea to add in there.
And it provides that timeline of progression,
Continuity.
which is cool too. Great. So we're going to move on to our first goal. When adding your goal, the very first thing that you need to do, and it's super important, is to add the category and then go directly to select the type of goal that falls within that category. If you were to dive right into writing out your statement and then select a category, it erases the goal statement. So just keeping in mind to start up from the top, then go to the goal, and then you can write your goal statement.
Categories, Jen, behavioral, emotional, social?
Yes.
Is that the ones we ended up with, I think?
Yeah. And we'll be able to kind of go through creating this second goal that we'll include in this video. So what I'll do here is just read the first goal, and then Kathleen and myself will type out a second goal. so that you guys can get that understanding as well. So for the first goal for Elmer, if Kathleen, you kind of want to just dive into.
Sure. So remember, Elmer is diagnosed with ASD and ADHD, so he has a hard time focusing. So our first goal, which is a little more general here, Elmer will increase his attention and time on task by 50% in the absence of engaging in protest behaviors for a period of 6 months. We're going to elaborate on what that looks like for engaging in protest behaviors as we go through this. So that's just the general goal statement.
Yep.
Time frame is the off dates, correct, Jen?
So the goal time frame would be, yes.
Okay.
Typically that would be then the end of the 6 month off. But if this can be kind of flexible, and it depends on the goal in general. So goal time frame.
As you're writing your goal, if this is a child who this is their first authorization, they may or may not reach that in that 6 month time frame. So sometimes we're looking at a kiddo where we're estimating the time frame as 2 authorizations out. When we get to breaking this down further, I can kind of speak to that a little more too. Do you want to keep going, Jen? I don't want to cut you off if you're.
No, I'm good. There you go.
Okay. All right, so role of the caregiver is really, what do you expect the parent to do, or the caregiver? Sometimes it's grandmom or whoever's there. This is pretty general too. You want them to be part of the appointments, be an active participant in session, and report on behaviors regularly. That's pretty standard for almost all clients that we're going to be engaged with. Of course, this can get much more specific once you know a child and have been on a case for a while, and should be, but at least as a general starting point, those are sort of the bare minimum pieces for that caregiver space. Settings and hours, we put across settings because for some kiddos, it is only school, some it's only home, some it's only camp, but we're putting here, across settings, the 12 hours of BSC, the home setting, they happen to have 8 hours a month of MT. If there were BHT, then we would add that in here. This is what the actual number of hours for each clinician are.
I did just notice for us in general, it does take getting used to, but the behavior consultant for
There we go.
I think we're good. Is the BC. So it takes me a while to get used to as well, but just do your best as you're writing out anything IBHS related, whether it be a progress note or a treatment plan, to use BC.
It's now just behavior consultant.
Yep. And recall that TSS is now behavioral health technician, BHT.
Are they, and I don't know the answer to this, we might have to get back to it, but are they specifying between BHT and RBT or no?
They would be, but it could go either way. If you're not positive if the BHT has the RBT certification, then that doesn't matter too much. So Kathleen did mention the goal's pretty non-specific, general, yeah. Here we kind of are able to, we have our goal, and then we have our target and replacement tabs, which is new to the IBHS treatment plan. So Kathleen's kind of going to go into the target behavior tab here.
Okay, and so we're going to change how we talk about things in IBHS so that things are more defined. So when we're talking about a target behavior, it's the behavior that we're really looking to either reduce or increase depending on what the behavior is. In most cases, it's a reduction goal, but that's not always the case, okay? So for Elmer, we're trying to reduce protest behaviors, and then we're defining them. What does it physically look like? So I don't want to know that he just has protest behaviors and tantrums. I want to know exactly what he's doing while he's having protest behaviors and tantrums. So in Elmer's case, he's throwing, he's screaming, he's slamming, he's flopping on the floor, he's refusing to look at materials. And then we're going to break it down further. So for every target behavior from here on out, you're going to be able to track, and we'll talk about notes later, but you're going to be able to track severe, moderate, and mild. in order for us to be as measured as possible and collect data on severe, moderate, and mild, I need to know what the definition of each of those intensity measures are. So this is very new, and people have not had to write this before. So I want to know exactly topography, which is what it looks like, which we described at the top. Then we're going to talk about severe. What does severe mean for Elmer? And for him, it's dropping to the floor, slamming doors, and then we're going to put a time limit on it. Okay, anything over, and Jen's picture, I'm sorry, you're blocking me so I can't see you, but let me move you. 15 minutes, right? Yes, okay. So anything, or I'm sorry, duration of 25 minutes for severe. Moderate is throwing and screaming, but notice it doesn't include dropping to the floor and it tends to be shorter. Mild, refusing to engage, dropping items on the floor, less than 8 minutes. So that when you go to take data in a session, when he is engaging in this target behavior, you can always rank it as mild, moderate, severe, okay? That allows us to track it over time. So multiple behaviors in one session might have different intensity measures, okay? Over the sessions over the month, you're gonna have a lot of different intensity measures. That gives us a whole lot more data, and we're able to measure not just how many times did it happen, but how long and how intense. So this is a change, and it's going to be an expectation when we're talking about what the target behavior looks like.
Yep.
Does that cover, Jen?
Yeah, that sounded really great.
All right. For the objective statement, this is where we're getting specific, okay? This is where I want you to define how long or how much or how intense and what you're looking to change, right? So for Elmer, Elmer will reduce protest behaviors as defined above. So you don't need to include throwing, flopping, all of that. It's right up there. From 25, or I'm sorry, defined above, from 25 to less than 5 occurrences daily. So right now, his average is 25 daily. We want him under 5, okay? While at the same time reducing duration from 25 minutes to less than 5 minutes, and decreasing intensity from severe to moderate over the next 90 days. So this is that 3-month window, because ideally every 3 months you're going in there and you're updating based on your data, based on how the interventions are working, and you're making some changes to that plan so that you're monitoring if the plan is still appropriate to the client. So the objective statement is going to give you those specifics. It's going to give you how much, how long, how much time you expect it to go on. Hopefully that all makes sense, but everybody can email me with questions. I'm happy to answer them. For baseline, what's happening right now, as in the time that you started treatment, what's happening. If this is a new kiddo, you're probably going to rely primarily on data from families. If this is a child you've already had, baseline data is really what's been going on, what's the data that you already have. So right now, Elmer's engaging in protest behaviors as defined above for up to 25 minutes, up to 25 times daily. Elmer's very busy. Approximately 80% of the data indicates that intensity ratings are severe. Behaviors occur across settings and caregivers. So this tells me how often they're severe, how long, and how many. And we need those numbers to be able to measure in 90 days and then another 90 days after that, where's this kid going? Is the data looking better? Is it not? And then that informs our treatment decision about whether or not interventions are working. So these are really important components that I think are going to be helpful in helping you guys make decisions for your treatment.
Mm-hmm. What is also different here is that under each goal, our previous BHRS treatment plan just had one intervention tab for the goal. What's neat about this is that there are specific interventions under this tab that are specific to targeting those behaviors we want to change.
Okay, so for interventions, this is really, you know, what are you designing to help this child reduce the behaviors, right? So this is, again, very general because this is a sample plan, but so the BC will design interventions such as, now each of these is its own program that you would be designing in treatment. So you're really kind of giving a list of what you're planning on designing, right? So Elmer needs a token economy. He needs some sort of reinforcement system. He needs visual supports that increase his time on task. The BC is going to collect, graph, and analyze data that's going to help you decide on treatment making decisions, right? And that's going to come from all of that additional data collection you're now able to do. The VC is going to train the family on the interventions that are listed there in that first line. So each one of those is its own training program. The VC and MT will model interventions for the family and give feedback. So if a family is being trained on an intervention, we need to be able to tell them how they're doing and what they need to make corrections on if they need to. Do I have anything under that for parents? I feel like I did.
You do. Yep.
No, okay. So the other piece of this that I think is important, because a parent is going to review this with you, is getting that parent to be invested in treatment. So this lists out the parent or the caregiver is going to be taking data and report major changes on behavior. They're going to engage in sessions. They're going to learn the interventions and implement them, and they're going to accept direction from us. Again, really, really general. Some parents are going to have much more specific interventions based on the plan, but this is general, just as a gauge to give you guys an idea of what at least needs to be there as a base point for a plan. And then
our replacement behavior is what we want to.
So this is really going to be different from our old plan. This is, what are you teaching the child to do instead of the behavior that they're doing, right? So we never, ever, ever say we're going to reduce one behavior without teaching skills for replacement behavior, because then we're going to get another behavior that we need to reduce. So we never take somebody's behavior away without teaching them something else to do at the same time. So this is that teachable skill set that you want to give the child. So for Elmer, Elmer will increase his attention and time on task as evidenced by the following. What do I want to see him do instead of what he was doing? I want to see him remain seated at the table. I want to see the materials we're working with stay on the table. I want to see his volume remain within normal limits. His eyes and body are oriented to the table, the assigned task, the speaker, whoever, wherever. Responding to questions within 3 to 10 seconds of being delivered, responding to prompts by engaging in the assigned actions. So what I've just described is the exact opposite of what I was seeing him do. Okay, so that's what I'm looking for him to learn how to do. So the objective statement's going to sound a lot like the exact opposite. Elmer will increase his attention on task as evidenced by engaging in the behaviors described above 5 times per session, while increasing duration from 3 minutes to 10 minutes. So that's what I'm looking for him to accomplish instead of the target behavior. So replacement is always, what am I trying to teach you? What am I trying to increase? It's usually increase, not always, but almost always. For this, we also do need a baseline, because I can't measure what Elmer is doing better if I don't know what he's already doing, okay? So this is, again, just where he's landing right now. So at this time, Elmer is engaging in on-task behaviors as defined above for up to 1 minute, up to 2 times daily. On-task behavior occurs more frequently in the presence of grandma and dad. Okay, so you're giving me where is he now, okay? That lets me know where I need to go. If I don't have a baseline, I don't know where I'm going next. So this is important. And then how am I going to teach him this? That's your intervention. Some people call it methods, but what are you going to use to teach him this? So for Elmer, some of the interventions might be a visual timer, a choice menu with an if-then board. Again, you're collecting data, right? So if you're on, whether you're on the individual side or the ABA side, and both sides can reach out to me, I have no problem answering questions. And if you need more support, I'm also here. But what we want to see is you're actually taking these numbers and you're paying attention to your trend, right? So Monday, Tuesday, and Friday, kiddo has session, and he's averaging 4 instances for every 2 hours. These are all things that tell you important information about whether or not these interventions are working. Parents are collecting data now too at this point. We're going to be asking them to do it more and more. So this is important to have in your interventions, because I want the parents to see it so that they know part of their treatment with you is collecting the data and using the intervention, so you can actually then make decisions about whether or not you're going to continue to use that intervention or you're going to make changes. Similarly, you know, the BC or the MT are going to model interventions, provide feedback. Parent or caregiver, very similar. They're going to make sure that they're in session, they're engaged in session, they're taking data, they're reporting major changes. And by major changes, these are things like if suddenly out of nowhere, Elmer decides that he's going to start engaging in self-injury and it's never happened before. You want to know that. That's a problem that you want to be able to address. If Elmer is making, suicidal statements, you want to know that. So anything that is major, and a concern, parents should know they should report that to you. They should be in sessions, they should be learning from you guys, and they should be able to sit back and have a discussion about how they did. We're there to teach them the skills. So in your treatment plan, one of your interventions is that you are providing them feedback. You are giving them some kind of sentence that says, wow, when you sat down with Elmer and you used the choice board, it was so great that you made sure it was in close proximity to him. You used his name. You told him, if you can sit through one more minute of this assignment, then you can earn the ice pop. Whatever it is that you've put in place, you want to be very specific with the family, and it needs to be in the plan so that the family's aware that they're a part of the plan.
Right. Kathleen, in a simple way, how would you tell a clinician that's going to be doing an IBHS treatment plan how to, in their mind, categorize an intervention that would go under the target tab versus the replacement tab? And some of them, as we see here, are similar, such as a lot of the parent pieces and some of the other pieces. But if you were to be able to allow someone to think really easily about that, what would you say?
So if we're talking about replacement, we're always talking about teaching ahead of a behavior, right? Not necessarily in response to a behavior. So if I know Elmer is flopping to the floor every time I ask him to take out a game to play with me, right? Instead of me having the expectation that this isn't going to happen and that I'll be able to praise him for doing it right, I need to figure out probably a shaping procedure, if I'm doing it right, in which I'm praising him just for little steps to looking at the board, getting the board out, getting the board halfway to the room we're going to use it in, getting the board to the table, sitting at the table. This is all little tiny baby steps in teaching, right? And that would be kind of like a shaping procedure that we would use. So anytime you're thinking intervention for replacement, you're thinking teaching skill or increasing skill that's already there. If it's a target, you're thinking after behavior almost always, right? And so I can do, all kinds of antecedent interventions, which are those, before the behavior happens. And those are often, again, they're going to fall under this replacement side because I'm reinforcing and praising the right thing. I'm shaping what I want to see, right? Whereas a target behavior, I'm providing something after the behavior has occurred, right? So I flop to the floor, right? Now I'm waiting him out. I'm reissuing a demand. If he's compliant, I'm praising. It's not 100% every time going to fall this way, but as a general rule, and especially for some of the BCs who might be newer to this, the interventions that are, for a target behavior are often those things that are falling after, not always. And for a replacement behavior, those are our antecedent interventions. Those are the interventions that we're teaching ahead of time. We're teaching a skill that's replacing the target behavior. Does that make sense?
Yeah.
Okay.
So what we want to do now is add a second goal. And then we will be able to save this and even save the plan and distribute it all via a PDF document to be able to reference this example. Once you're ready to create a second goal, similarly to the previous treatment plan, you're just going to go up to the top and say add goal. And now we have our second goal, which comes with the target tab, replacement tab, and both intervention tabs. The second goal that we talked about for Elmer would be managing his frustration and anger.
And this one you're going to have to bear with us. We're trying to touch the MT side, which is less strong for me. So you're gonna have to forgive us, but we're gonna aim to be fair here. So if we're going in that space, we're obviously gonna go more on the emotional end because this is an emotional goal.
And
Coping.
Yep, coping skills. So our goal statement here is going to be read very similarly to our goal statement for our first goal. So I almost think it's very easy to copy and adjust it for each goal. So Elmer will, and Kathleen, you can help me out.
What did we have before?
This was just copied, yep.
No, but I mean for his, we were reducing what? Or increasing frustration tolerance? Is that how we were wording it?
This was his first goal. Elmer will increase his attention and time on task by 50% in the absence of engaging in protest behaviors. So
right,
we might want to change it to be coping skill.
Right. So we can change this into Elmer will increase his ability to engage in coping skills. And we'll say by 50%. And guys, notice what Jen just did, which made life easier. Kind of the same template. In the absence of, I don't know what we want to have Elmer do. Do we want Elmer eloping out of the room? We can have him eloping. It's fun. In the absence of elopement, Jen, go backwards for me. I'm sorry. In the absence of elopement from the instructional area. And we can do kill the protest behaviors part. There we go. And again, super general here because you're going to hone in on all of the details in the other two sections. So this is just your general. So apparently when Elmer is having some moments, he might elope and he needs some skills when it comes to dealing with his frustration. So this is just your general statement. This is not going to be your actual measurement statement. If that makes sense.
Right.
I forget your dates.
I believe
10
it was 10,
16,
11.
I don't remember.
And 10, 15.
Role of the caregiver, again, we're going to be very general here just because this is the same. So Jen's going to take it from the other section. If it changes because of the intervention or because of behavior, obviously you're going to put something different here. Settings and hours are probably also going to populate in as the same, unless the only exception to this would be if this is a community goal. So say you have a kiddo who is only eloping when in the community. This isn't a goal that you would work on then anywhere but the community setting. So you would be able to specify that with a sentence in that section.
Mm-hmm.
Okay. And updates is just, obviously if it's a first one, it's harder to put in, but as you
right.
go.
So since this is Elmer's first initial
right.
treatment plan, this is grayed out. As you review, it is expected that you'll provide
an update.
An update. So now we have our target behavior.
Before you move on to that, let me take you back one. So one of the things I want you to think about with that update is instead of reinventing the wheel and creating something new, one of the things that will be easier if you are actually collecting and graphing data regularly is this. You can go backwards and actually look at your notes from last month when you graphed and analyzed data for this goal, and your narrative discussion of that is your update. You know, Elmer has decreased, elopement when frustrated by such and such percentage between now and 6 months ago. And all you have to do is look at those two data points and boom, that's updated. So it does make your treatment planning easier if you're following that kind of format. Great.
Target behavior, objective statement, baseline.
Okay, so this is the same process. We're just going to change it to what Elmer is doing. which is his elopement. So Jen, do you want to pull or no?
Yeah.
Okay. So same thing.
It really helps for just like continuity and the fluidity of the treatment plan to pull.
Not reinvent the wheel. Okay, so in this case, he's not reducing his protest behaviors. He's reducing elopement behaviors. And then we're gonna list what those elopement behaviors are. Okay. Okay, so instead of the throwing part and all of this, Elmer runs out of the room, slams doors, screams, "I'm leaving this place." Refuses to return to the instructional area. And on occasion attempts to leave the home. So this is what his elopement from the area looks like.
Repeat that last one.
And on occasion leaves the home. Attempts to leave the home, not leaves the home, sorry. Now, for your severe on this one, this is kind of like a no-brainer. Elmer has left the home, right? So Elmer has either made it out the front door or is, running away from the home. And this can last anywhere from 10 seconds to 30 minutes. Hopefully this is not something that occurs often for Elmer. Okay. Okay, for moderate, right? Elmer leaves the room, slams doors, and refuses to return to the instructional area for up to 30 minutes. Okay, and for mild, Elmer threatens or actually does leave the instructional area. Oh, I'm sorry, I meant to give you there you go.
I forgot to add that part. Okay,
you got a double duration. For moderate, Jen, you have double duration. I don't know if you need it.
Okay, let me do this then.
There you go. Okay, so for mild, Elmer threatens to leave the instructional area or leaves the instructional area for up to 15 minutes, but returns and completes assignment. And for all of your intensity measures, these are extremely, extremely personal for each kid. So this is going to be different with every single child and every behavior. And it's going to be based on data you've taken and observations you've made and parent verbal reports. So this is going to be highly specific for each individual. So again, Jen's just taking kind of our template so that you have all the same points of collection in there. So instead of reducing protest behaviors, he's going to reduce elopement behaviors. Okay, how many times do we have? We don't have a time amount on here, do we? Do we have a frequency on here? No, so we're going to give him a frequency. So from 30 occurrences to less than 5 daily. I think for an elopement goal, we would probably be lower. So let's make him from 10 to 2. And then we want to take duration from 30 minutes to 10 minutes during this time frame. And we can leave severe to moderate for now for the 90-day.
Mm-hmm.
And so this is really easy too. And one of the things that's confusing is this. When we're doing our objective statement, Jen and I, we kind of just did it out of order for you, because ideally we've already got baseline information that's going to give us objective statements, right? And so right now, our assumption is that Elmer is engaging in 10 elopement occurrences per day, if we're looking at the objective statement, and that these are they can be up to 30 minutes, right? So baseline right now is Elmer engages in elopement behaviors up to 10 times daily, anywhere between 10 seconds and 30 minutes. So if we've already got baseline, in some ways I'm telling you to do it slightly out of order when you get to this section, because if you've got good baseline and you've got a good explanation of the target behavior, the objective statement comes very naturally.
Yep.
So that's 30 and 10. And this could be, anything here, depending on where your ratings are. So we can leave it as you would like.
Great. Perfect.
Okay.
Interventions.
Okay. So for your interventions, this is your target behavior. So what you're looking to do is a lot of the same things we were looking to before. The parent interventions on this section, I'll get to in a second, but
those would likely remain the same.
They're likely going to remain the same, especially if this is a brand new case. If this is a case you've been on for a while, they're going to be different. But for a brand new case, that's kind of your minimum standard. For an elopement case, we're looking for interventions that are going to decrease elopement. So we're trying to make sure that we're reinforcing when he does come back to the table. So we can use a reinforcement system. We can use a token economy for him. We can use visual supports. It just so happens that these two mesh well. This is not going to be the case for all of them. We also need to be able to put in, for an elopement behavior, probably something like a response cost, which is there's a consequence for the elopement for this particular kiddo. So it's something I would add to this guy. So design a response cost system when elopement is achieved. Achieved, sorry.
Achieved, sorry.
Okay. For this particular family, if elopement is an issue and the kid is actually leaving the home, there's probably going to be teaching the family how to use corralling methods in order to keep the child in the home safely.
What did you say?
I'm sorry, to teach utilization of corralling methods in order to promote safety.
What's the word?
Corralling, like a horse. Corralling.
Oh, okay. To bring him home. I got you. Spell that for me.
It's C-O, I think it's R-R-A-L-I-N-G. I gotta write it down. I can't ever spell anything out loud.
Corralling.
I think it's a double L.
Double L, yep.
C-O-R-R. Yep.
Yep.
Okay. And then the other thing that we're probably going to do is provide psychoeducation regarding physical modifications to the home that promote safety. So this is a discussion probably about things like window and door alarms, or making sure that you're closing the family fence, or things like that. But you don't need to write all of that in your plan. You're providing psychoeducation on physical modifications for the family home environment. Sorry, I talked too fast, John. To promote safety. Okay, and so like elopement is one of those, along with self-injury, that we need to really harp on safety in our plan, because that's the reason we're there. So this is one of those pieces. Okay. Again, we're graphing and analyzing data. We're training the family on our interventions. We're modeling and providing feedback. Those are sort of in every plan, or at least they should be.
Yep.
And go ahead, Jen, I'm sorry.
No, I was just agreeing. And
parents, again, because this is a new plan and it's general, we want to know, did Elmer actually make it out of the house and down the street? Did something terrible happen? We want the parents to be reporting that information to us. We want the parents present for sessions. We want them learning and implementing what we're teaching them. And we want them to be okay with being told how to do things differently. That's why we're there. We're there to teach them. We're there to generalize skills. From the very beginning, from the very first plan, they need to know that is our role. We are teaching them new skills with regard to their child's behavior. So we want to tell them that, because if they can't take our direction, we're not very effective. So it's in the plan every time.
Perfect.
Okay. So again, you're writing an opposition to be very, very clear. I want you to define that. So Elmer will increase his ability to remain in the instructional area. And I want to qualify this because I'm trying to write this in an MT-ish way too, because I want to kind of help the MTs with their goal pieces too. So we focused on the reason he's eloping is, you know, frustration, intolerance, and, you know, it's something is hard or a task demand's been presented that's too much, and so he's taking off, right? And so what we can add in here to make it, I guess, a better MT kind of based example and speak to the emotional pieces which are related to the interventions is Elmer will increase his ability to remain in the instructional area when tasks that have been identified as frustrating or difficult by the IBHS team are presented to him. Okay, and then our as evidenced by the following is going to be what we would like him to be doing. Some of this is going to be a little redundant. Mm-hmm. So we would like him to remain in the instructional area. Remain in the home. Utilize coping skills that have been taught by the IBHS team, including but not limited to. So this is where you're going to give a list of what you'd like him to do, right? I'll wait, Jen, because I don't want to get ahead of you. Pacing, using fidgets, deep breathing, shredding paper, whatever intervention, whatever replacement you're giving to Elmer so that he can stay in the home safely, or better yet, in the instructional room that he is. Those are the things you kind of want to list here. I say included but not limited to because obviously this list is going to be very different based on this child and what you're teaching him to use instead. But this just gives us a gauge for this planning purpose, right?
Yeah.
So let's do, Jen, let's do baseline first so that we can do what we were talking about last time.
Yeah, I like that idea.
Okay. So at this time, Elmer is engaging in elopement behaviors as defined above for up to 30 minutes.
Should this actually,
replacement.
Yes,
sorry.
I copied it from the wrong one.
Yep, no, my coffee just is wearing off. I'm sorry, guys.
There we go.
I missed it.
Whoops. Okay.
Okay. So at this time, Elmer is engaging in utilization of coping skills as defined above. And we'll say for up to 10 seconds once daily. So he's having a hard time. Okay. And engagement in utilization of coping skills occurs more frequently. We'll give mom this one. Mom gets this. And let me just speak to baseline really quickly too. So baseline gives us lots and lots of important information too. So the reason that we're saying one is in the presence of mom, one is in the presence of dad is because kids are different for different people. And if he's able to do something we would like him to do with mom, but not dad, it's a behavior we don't necessarily have to teach and retrain, but we need to reinforce in the presence of both parents. And so sometimes that might mean that I have mom and dad standing next to each other and he's able to do this deep breathing with mom, but he doesn't typically do it with dad. So now dad and mom are standing next to him and mom is coaching him, but dad is present. And then a week later, dad is coaching, but mom is still present. And then another week later, dad is still coaching and mom is 2 feet away until we have him doing it with dad. And so it's important to note under what conditions we're getting a behavior so that we can shape it if it's already there. Okay, so Elmer will increase his utilization of coping skills. Okay, and for him this time, we're gonna ask him to do it 3 times per session, increasing duration from 10 seconds to 1 minute. And in 90 days, we're going to change it and increase that, hopefully, if he's doing well.
Perfect.
Okay.
Interventions we can copy from.
Okay, and again, interventions are under the replacement section. What are you teaching him to do instead, right? And so we never ever take away a whole behavior without teaching a replacement, because then we get another behavior and we have to get rid of that too. So we're always teaching that replacement behavior. So for Elmer on this one, I'm probably not using a visual timer. I'm probably not using a choice board. I'm probably using some sort of visual reminder card that is telling him, you know, about remaining in the home. I'm probably providing him with fidgets or sensory items that he can use, and then I'm also differentially reinforcing use of those items. I might be reading safety social stories to explain why it's so important that we're in the home. I might be using a token board for utilization of coping skills instead of elopement, and that allows him to go cash out for a highly preferred item like iPad time.
What'd you call this?
A reinforcement system, a token reinforcement system, sorry, paired with a high magnitude reinforcer. I was explaining before I was titling, sorry.
No problem.
Okay, it's always going to catch it because it wants you to write reinforce. It's never going to let you do it.
Okay.
All right, and then so, and I just want to specify too, for everybody who's on the individual side who might not speak the ABA speak, that I always kind of get stuck going back to, reinforcer is just what do you want them to earn? You know, that they're willing to work for. Mm-hmm. So same, we're going to collect, analyze, and graph data. We have to do it. It matters. We're going to train the family on our interventions. We're going to give them feedback. We're going to have an expectation the caregiver reports any issues. We're going to make sure they're engaging in sessions, that they're implementing what we're teaching them to implement, and that they can take feedback from us about how they're doing.
Perfect. So that is our second goal.
And guys, if you're an MT, forgive me. I'm sure that you could write an MT goal much more brilliantly than I could. But this was my attempt to be inclusive.
And just a reminder, we will be saving this document as a PDF to be able to email and distribute out to everyone. But the video explanations are also incredibly helpful. The signature tab is straightforward, similar to our last signature tab. And this information tab, you at this point don't need to worry about. If we do start to bill the service in the future for IBHS billing, then that is something that you will be informed about. But the completed information, demographics, and then adding your goals and ensuring the signatures once we are, of course, back to face-to-face sessions. So I'm going to go ahead and save this. And I will come back to stopping sharing. And what Kathleen and myself will do now is approve that plan and be able to run through what our new IBHS progress note looks like. Any last remarks there, Kathleen?
No.
Okay, thank you guys.
Thanks.